Happy Tuesday. It's me, Myra, again. Time for another anatomy lesson. If you haven't seen the one from last week, the ankle, please go back and review, orientate yourself. Also, if you haven't seen the medical terms lesson a few weeks back, please go back and look at that one again, and to orientate yourself to the terms, okay? We're going to get started now with the foot. Next week, we're going to be going over the shoulder. We're doing the arm now. We've done the lower legs, pelvis, hips, and all that. So we're going to start at the top next week and start with the shoulder. So without further ado, let's get going. The foot contains 26 bones, which encompasses the tarsals, the metatarsals, and phalanges. I'm going to show you a picture in just a second of all of those, and we're going to name them 1 through 5 all the way down, okay? The foot has many parts, including bones, joints, ligaments, tendons, nerves, and blood vessels. There are 26 bones in the foot, which are divided into 3 groups: the hind foot, the midfoot, and the forefoot. The hind foot is made up of the calcaneus, the heel, and the talus, which work together to allow inversion and eversion, dorsal flexion, dorsal extension, and also plantar flexion. The midfoot contains the metatarsals, which lay between the ankle and the toes. They consist of the navicular, cuboid, 3 cuneiforms, medial, middle, and lateral, and also, once again, the metatarsals and the phalanges. Phalanges are the toes, okay? So that's the midfoot. The forefoot contains the phalanges, toes, metatarsals, and sesamoids. And we'll go over what a sesamoid is momentarily. Let me turn the page here. Each toe has a proximal, middle, and distal phalange, toes, except the great toe. It only has 2, distal and proximal. The joints allow for easy movement. The ligaments provide stability to the joints. Tendons connect each bone to one another. We have already learned that before. The muscles contract to cause movement. There's 2 types of muscles in the foot. Intrinsic is the foot responsible for the movement. Extrinsic, outside of the foot, in the lower leg, and the calf muscle helps move the foot. The nerves of the foot are called the deep peroneal, superficial peroneal, tibial, cerebral, and saphenous nerves. Plantar fasciitis is a sheet of fibrous tissue. We've discussed this before, but now we're in the foot, so I want to show you some pictures in just a second. But plantar fascia is a sheet of fibrous tissue that supports the arch of the foot and contains muscles. When the fascia is thickened, it can cause fasciitis, which causes pain in the heel or bottom of the foot when standing or walking. It is very, very painful. If you've ever had it before or know someone that's had it before, you definitely can agree. Plantar fasciitis is no joke. I'm going to spin you around now. We're going to go over all of the pictures for today. Turning you around. All right, so here's a picture of the entire foot. Some of these we have already gone over whenever we did the ankle, but we're just going to reorientate ourselves once again. Let me find my ink pen. There we are. So once again, there's the fibula, distal tibia, medial malleolus, lateral malleolus. Here's the talus. Now, here's the calcaneus. We're kind of looking down, so you're not going to see it on the lateral projection. But that is also the calcaneus there. Coming over, here's a navicular. Think of these bones as the bones like in the wrist. Think of these like the bone in the hand, and these will be the fingers, but these are the toes, okay? So we're on the medial side, navicular, medial cuneiform, middle cuneiform, lateral cuneiform, and the cuboid. Now we're starting with the toes. So remember what I said, the big toe only has two, a distal phalanx and a proximal phalanx. This is the first metatarsal. So this is toe number 1, second toe, third toe, fourth toe, little toe. Okay, so here we go. First metatarsal, second metatarsal, third metatarsal, fourth metatarsal, fifth metatarsal. Now we're going to go up to the phalanx, to the toes. So once again, proximal phalanx, first digit, proximal phalanx, second digit, proximal phalanx, third digit, proximal phalanx, fourth digit, proximal phalanx, fifth digit. So once again, they didn't have a middle over here. So middle phalanx, second digit, middle phalanx, third digit, middle phalanx, fourth digit, middle phalanx, fifth digit. Once again, doesn't have a middle, so we're going to distal now. Distal phalanx of the first digit, distal phalanx of the second digit, distal phalanx of the third digit, distal phalanx of the fourth digit, distal phalanx of the fifth digit. Okay, that's the whole entire bones of the foot right there. So once again, we have the talus, we have the navicular, lateral cuneiform there. We have the cuboid over here, the lateral side. All these are medial. These are kind of middle. Lateral is going to be over here. So let's turn the page. We can see from the x-rays what they look like. So here is the calcaneus again, the talus. This is the tibia and fibula superimposed, navicular bone. The cuneiforms, 3 cuneiforms are there. Here's the metatarsals we just saw, and the toes, the phalanges. This is looking down, looking up. So our big toe is going to be over here. So metatarsal, 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 metatarsal. You really can't see the toes there. They'll be up here somewhere. These little bones right here, there and there, are called sesamoids. They're just round calcium that looks like bone. They really don't give us very much trouble, more than likely. Sometimes they do, but not very often. So there's navicular bone again right there that we saw in the previous photograph. And I just wanted to show you what this is a x-ray of the side view. So those sesamoids, there's a sesamoid right there, bottom of the foot. Once again, the calcaneus. You can see the calcaneus better on a lateral sagittal view than you can an AP view. Once again, tibia, fibula, talus, and these are all navicular, cuboid, the cuneiforms, the metatarsals, and the phalanges. Moving on. Once again, there's those sesamoids again, there and there. So this is going to be your distal. These are your distal phalanges. These would be your middle phalanges there. Your proximal phalanges there. Your metatarsals, your sesamoids again. And then your cuneiforms, navicular, and cuboid. You can barely see them from this projection. And then right inside here, that would be your tibia and fibula on the lateral side there. Now, these are just showing you your arteries. We discussed these before when we did the ankle, but once again, dorsal pedis artery. Whenever you go to the hospital, they want to make sure you're having blood supply to your foot. They will take their fingers and kind of put it in this area to make sure they can feel a pulse. Dorsal pedis artery there. Lateral tarsal artery. Dorsal metatarsal and digital artery. So this supplies the blood supply to your toes, your phalanges there. So lateral plantar, so we know that supplies it on the lateral side. Medial plantar supplies the arteries to the medial side of your foot. And then the sole plantar surface would be underneath the bottom of the foot. Bottom of the foot. Plantar surface, like you're going to plant your foot on the ground. These are showing you the nerves. The nerves are called the plantar nervus to the sole of the foot. Lateral plantar nerve there. Medial plantar nerve. Remember when I always say if you've had a medial, you have to have a lateral. If you have a proximal, you have to have a distal. Okay? It's just showing you plantar surface of the foot. Plantar nerve. Lateral plantar nerve. Medial plantar nerve there. This is plantar fasciitis, is just the stretching of the fascia. Fascia there, there's the muscles. Risk factors between 40 and 60 years of age, overweight, but going barefoot. There's the arch, calf muscles, Achilles tendon, trimester of the pregnancy, last trimester, because you have that baby that's weighing you down. That can be a risk factor. So once again, plantar fascia becomes irritated and swollen. One of the most common causes of heel pain. Common in runners, teachers, and factory workers because they're on their feet all day. Treatment depends on severity. Rest, ice, and stretching. Different shoe inserts, night splints, anti-inflammatory meds. We've gone over this last week. Physical therapy, corticosteroid injections, total or partial surgical release. That is probably going to be on the more bad side. Common causes of foot pain. So we talked about Achilles tendonitis last week. There's the Achilles tendon again. Tarsal tunnel syndrome. Osteoarthritis. Morton's neuroma. There's that plantar again. Plantar fascia. Plantar fasciitis. Ingrown toenails. I can't tell you how many ingrown toenails I've had to have removed in my life. Ingrown toenails. Corns and calluses. Bunions. If you ever had bunions, they had to be surgically removed. I have bunions myself. I just don't want to go through the surgery. Metatarsal algia. Algia means pain. Hammer toe. Hammer toe there. Now, fractures. Here's a fracture of the fifth digit. Fifth metatarsal. Metatarsal. Remember, here's the metatarsals here. All 5 metatarsals. This is the fifth. So there's a fracture there. How would they fix that? Well, let's see. I know this is not the fifth digit that's fractured on this x-ray, but you get the gist. They can put nails and plates in. Will be on this side over here. That's surgical intervention. Same one, just turned x-ray, just turned a little bit to see a little bit different angle of that. Now let's just talk a little bit about common related foot injuries before we go. Foot injuries. So Achilles tendonitis, we've already talked about, which is a common foot and ankle condition that can be treated. Effects, once again, it's the largest tendon in the body, the Achilles. Like many musculoskeletal injuries, Achilles tendonitis typically occurs because of overuse, often sports, degeneration, wearing down with age, and time. Once again, plantar fasciitis. The condition happens when the band of tissues, the plantar fascia, supporting the arch of your foot, absorbs too much stress. When the tissues are strained from activity like running, they become inflamed, causing pain at the bottom of the heel. Stress fractures. Athletes who participate in sports like running, basketball, tennis, gymnastics, and dance are usually at a higher risk for foot and ankle stress fractures because of repetitive stress placed on their feet and ankles. A lack of conditioning, proper equipment, or technique can result in disrupting the mechanics of the foot and ankle and result in a stress fracture. Unlike a fracture, which is a broken bone, a stress fracture is a small crack in the bone. Small crack in the bone. Once again, stress fractures happen when repeated impact is placed on a bone and our muscles are unable to absorb the stress. This can happen anywhere in the foot or ankle, but the second and third metatarsals, oddly enough, are usually hit with stress fractures more frequently. So stress fractures are more likely seen in the third and the fourth metatarsals. Ankle sprain. Like most injuries, a sprained ankle can be very moderate, causing minimal pain or severe, and making walking and standing difficult and/or painful. All ankle sprains involve twisting of the foot, causing damage to the ligaments of the ankle. Inversion ankle sprains are the most common type of sprain and caused by twisting the foot inward, resulting in damage to the outer ligaments as they are stretched. Eversion sprains caused by twisting the foot outward usually cause more severe damage to the inside ankle ligaments. Neuroma. We saw that on one of our photographs. If you have pain in the ball of your foot, tingling, numbness, these are symptoms associated with a neuroma, a condition involving a pinched nerve in the foot. The main symptoms people experience with a neuroma is pain between the toes while walking. While there is not an exact cause, many different things may play a role in the development of a neuroma, such as flat feet or feet with high arches, overuse or stress, wrong shoe size and style, and trauma. Ladies, heels are bad. High heels are bad for you. Seen too many traumas. These factors can cause inflammation, instability, and stress, which may lead to a neuroma. Heel spur is just extra calcium on the bottom of your heel. A heel spur is a calcium deposit that results in a bony protrusion, like a little hook, on the heel bone. When the plantar fascia runs along the bottom of the foot from the heel to the forefoot, it stretches away from the heel. Athletes with either flat feet or high arches may be more prone to this condition. Other contributing factors including running on hard surfaces, improper footwear, age or weight, walking gait that places stress on the heel, and even diabetes. Heel spurs can cause extreme pain in the rear foot, hind foot, especially while standing or walking. The majority of people with heel spurs are treated non-surgically by either one of the following or a combination: physical therapy, heel stretching exercises, muscle and tendon taping, anti-inflammatory medication. Okay, that is it for this week. I hope you've learned a lot about the foot. Remember that next week we're going to be going over the shoulder. We're going to start up here. So far we've done the head, we've done the neck, thoracic spine, lumbar spine, pelvis, hip, femur, knee, tib fib, ankle, and foot. If you haven't seen all of those videos, please go back and look at those, and I will see you again next week as we start the shoulder. Have a good day. See you next week.